Please join me in a spirit of contemplation. Please stand. Between the heart and mind, there is a connecting passage. Not the kind that can be seen, but the kind that can be felt. For each person present here, I ask that that passage be opened. There is a place in the midst of every gathering, around the people and within them, where the potential of individuals is joined and magnified. For this gathering, I ask that that space be filled. Many paths have brought us here. Many paths lead forward. But in this hour, we have a single aspiration, and we are grateful. For the satisfaction, and for the camaraderie, and for the joy that we feel. May those hallmarks of this occasion give rise to loving kindness. Amen. Please be seated.
Good evening, and welcome to the 54th commencement ceremony for Galen College of Nursing, Cincinnati campus. On behalf of Galen College of Nursing, the Board of Directors, and our CEO, Mr. Mark Vogt, we take pride in welcoming each of you to the summer 2022 commencement activities. We are here to recognize, acknowledge, and celebrate the magnificent achievements of all of these graduates sitting before us this evening. I would like to refer to the words we just heard in the invocation. The potential of the individual graduates here tonight is intensified and magnified as we gather to celebrate all of their accomplishments. It has been a difficult journey through a pandemic that was filled with many challenges. Many paths have brought us here to this celebration point tonight, and there will be many paths that lead you all forward. As we know, every graduate has reached this moment with the loving help of family members and friends. I would like for all of you graduates to stand up, face the audience and your loved ones, and give them a round of applause for their support, because I'm sure without them, you would not be here this evening. Another group of individuals I would like to thank are the faculty and staff at Galen College of Nursing. We all benefit from the individual expertise, the words of wisdom, encouragement, and coaching that they all provide. Thank you all for your dedication and commitment to education. There are a few things more exciting than a commencement, and we are so proud of all of you and what you have accomplished. We are excited for your success and proud to be in your company. Commencement means a new beginning. This commencement is a celebration of your new beginning. While you close one chapter, you open a new one, and so many things await you in this new chapter. We are grateful to share your joy this evening. We are here as friends and new colleagues along your life journey, because all of us should remember in mind and spirit that life is always about beginnings. So welcome, and I hope you enjoy the activities for the evening. Next on the agenda are our speakers for the evening. We have three. The speaker that was chosen for the Associate Degree Nursing 2-year program is Barbara Page. Barbara would come up to the stage. The speaker chosen for the Advanced Standing program, Tricia Peterson. And the speaker chosen for the BSN program, Brendan Horick. So our first speaker will be Barbara Page.
All right, well, I was walking up here and I thought, well, we all have one thing in common. None of us know what I'm gonna really say. The human brain starts to work the minute that we are born, and it stops the minute that we stand in front of everybody to give a speech. So when I was advised that I was going to get voted, thank you classmates, to do this speech, they advised me that I couldn't use profanity, I couldn't bring up risque topics or controversial issues. And I was like, well, this will be short. So when we started this journey many, many moons ago, we didn't think it would feel like a road trip with many potholes, speed bumps, and most of the driving done in a ditch. But here we are. My question to my adventure, starting this at age of 50, when am I too old? What am I doing? And on day one of my orientation, when a young student told me how cool it was that I was there, I was like, sweet, not too bad. And then there were some words exchanged about somebody's mom being older than me or me being older than their mom, and that's where that went. So we spent, I'm gonna continue. We spent about first half of our quarter in campus, which was great, and then COVID showed up, unfortunately. With my friends said that nursing school would be a Zoom, I don't think they meant the Zoom that we were about to face. Now, most of my classmates were proficient with computers, so they were like, okay, no problem, computers, we got this. I, however, spent 10 minutes trying to figure out how to turn my computer on. They were talking about zip drives and PDFs and Word documents, and I'm like, isn't there a floppy disk someplace? Zoom was very entertaining in the sense of, I found out, I think it's some of our classmates, that the mic button, the mute button was a very important piece. Because if you didn't have that on, it was kind of like a reply all when you were emailing. And it was very interesting when our instructors would ask a question and we'd have multiple of us trying to answer, and then we'd just all sit there and be like, and it was very awkward. Our attire for Zoom class, however, was kind of nice. We had the laced up from the waist up approach, in the sense of, nice shirt, and we weren't really sure what on the bottom. So that was kind of pleasant to roll out and be right there. Fast forward a little over a year from there. Yes, a little over a year, we did Zoom class. We all did Zoom class. We get to come back to campus. Woo, spirit fingers. Problem is we have to wear a mask. Not too bad. And we have to do 6-foot distance. Now, mind you, I said I was 50 years old. Menopause. Imagine a mask, glasses, hot flashes, steamed up glasses. I gotta look six feet away to see my classmates. Last quarter, I finally realized who all my classmates were. When I could see them, all I could see was ears, forehead, and eyeballs, because we had our masks. So it made coming back very interesting, but it did prove to us one thing, that we were able to overcome anything that was handed to us. Whether it was an impromptu VSIM that we enjoyed, or just we're gonna watch a movie and talk about it type situation. Like I said, it was a happy adventure for everyone involved. When we got back to school, it proved to us that we were able to handle this. There was a day that we had a dumpster fire, a legit dumpster fire in the parking lot. Some of the students that were not in our class were all like, oh my gosh, there's a dumpster fire. Our class is sitting there with popcorn, man. So that's pretty much how our adventure went. We learned a lot of things. We learned that we are very superstitious when it comes to exams. Scott, did you eat your Twix? We did not want to know if it was the left or the right Twix. We did not care. Don't put that voodoo on us. I had to have 2 pencils. It was on a computer, but I had to have 2 pencils. The day before, when we found out that we were going to be in a computer class, we were destined that we were going to fail, because we had to be in the same class, same seat, pencils, Twix, or it was not going to happen. It would cause major meltdowns. Things that we did learn: nursing diagnosis with care plans. That was fun. Nursing diagnosis, it had its place. We learned a lot of things about nursing diagnosis. And nursing diagnosis in the sense that we are nurses. We cannot diagnose. The doctor diagnoses. But there is not going to be a point that I can see in the future that I will not say the patient has impaired gas exchange related to altered delivery of inspired oxygen as evidenced by cyanosis, instead of, he ain't breathing. I would like to take this moment to say thank you to our staff. and our professors, our clinics, our clinical instructors, and for putting up with all of us. There was many times I know on clinical day at 6:45 when we're all like, oh my God. And before our instructors are having their first cup of coffee, they've been asked 14 times when it's lunch. We haven't even had breakfast yet. And I'm sure with all the emails of when are we going to find out our grade, or this, that, or this, I'm sure the instructors were about to be done with us. But I do want to say thank you very much for your perseverance, your guidance, and your knowledge through it all. Without you, this would have never happened for a lot of us, especially your patience with some of us who may have slept a little bit or had a Control-Alt-Delete. Most importantly, as Dean had mentioned, I'd like to thank you to our friends and families. Without you all, this definitely would have never happened. Without having to pick up extra shifts at work, taking extra chores at home, dealing with our mood swings. We could have never done this by ourselves. The support that you all provided to us, my classmates, will be forever not forgetting. Whether you had a tissue for our tears, a beer for our fears, or just lent us an ear, we are always going to appreciate what you did, the sacrifices for us. Thank you for going on the ride together. To my classmates, it has been a journey. Thank you for appreciating me for being old, sarcastic, and fat. I do think that my appearance helped on some of our diagnosing and some of our health issues. But we made it. We made it. And with that I say, life is your destiny. What you make of it. Take chances. Don't ever think you can't do something because you are too old to make a change in your life. When that little voice in your head says you can't do this, smack it, because you can. You can, you will, and you did. And we are here together celebrating that. Thank you.
What a speech to follow. I have to find mine. Here it is. Good evening, faculty, family, friends, and fellow registered nurses. I read a meme online that said, nursing school taught me two things. One, the mitochondria is the powerhouse of the cell. And two, how to calculate the lowest grade I can get on the final and still get a 78 in the class, or in our case, a 74. We've all been there, right? Nursing school has taught us how to roll with the punches, to hustle when we need to hustle, to step back and take a breath when we need to, and to pee at least once every 4 hours. It has taught us how to be more compassionate, more caring people, and how to be more assertive as we learn how to find our voices, to advocate for our patients, all while we learned to love Pop-Tarts and Twix from the student lounge. Resilience is defined as the capacity to recover quickly from difficulties and toughness. I think every one of us graduating tonight can say that we are resilient. We have suffered hardships, setbacks, and losses, and we made it out to the other side. Remember when you're out on your unit and feeling overwhelmed, how strong you are. We're all rock stars. We did things at times we thought we couldn't do, passed tests and classes we thought we would never pass, and pushed forward on days we wanted to give up. And guess what? We did it. We made it. Our teachers taught us to look for the meaning behind signs and symptoms, to learn what is normal in a disease process so that we can understand what is abnormal, and our classmates taught us what's important in life, health, family, and friends. Our Nursing Today book has a quote that sums up nursing school pretty well, especially in our advanced standing program. Each quarter, you will get regrouped with new classmates. They'll become your family and your support system. You will form a chain, and everyone is a strong link. This is a group effort. These are people who will laugh with you and cry with you. You will form friendships that will last a lifetime, and all of this is true. I have never had such a supportive group of people in my life. As we go forward in our careers in life, I hope we can all remember the feeling of accomplishment that we feel today and use that feeling to carry us forward. I know each of us will be a wonderful nurse no matter what career path we choose, and I'm so thankful to have known and grown as a nurse beside each of you. Thank you.
Alrighty, guys. Yeah, those are hard acts to follow. Those were beautiful, man. I appreciate my classmates asking me to speak. Sydney, I nominated you just so you know. I don't know where there you are. You're not there? You disappeared, man. It's all good. It's all good. I want to start off by saying that I'm grateful for each and every one of you in this room today. There are no words to express how incredibly unpredictable these last few years have been. These last few years have brought us to the brink of desperation. Every fiber of our being was tested in almost every way imaginable. There's not a single person in this room who is exempt from this. I tried to piece together how we got through this, not collectively, but as individuals, because those two answers would be incredibly different. At first, I considered the word resilience. I've never been the biggest fan of the word resilience because most people demonstrating resilience are only doing so out of absolute necessity. I then considered the word love, as none of us could have made it through this without other people taking us as a part of themselves, and with us taking others as a part of ourselves. But even with the idea of external love, there was something underlying that was being unaccounted for. In my honest opinion, self-love is the single factor that got each of us through these past few years. When we think of self-love, especially in our society that's obsessed with happiness at all costs, we most frequently think of taking a mental health day, going to get a massage, or treating ourselves to our favorite comfort food. And while all of those things are the valid and obvious forms of self-love, I think that the other ones also need their time in the spotlight. Getting out of bed, brushing your teeth. It's a big one, man. It's a big one for a lot of people. It really, really is. You know? Taking a shower, or depending on the context, giving yourself time to rest, waiting to brush your teeth until the morning, or skipping a shower for a day or two or three. All of these at different times can be self-loving, but we cannot pour from an empty cup, and the question has to be raised. What do we do when we do not feel like loving ourselves? What do we do when we do not feel like we are capable or worthy of love? I'm not sure this has ever been done at a graduation before, but here it goes. I want to invite every single person in this room, student, faculty, family, to close your eyes and get comfortable in your chairs. Every single person. I want you guys to take a second, get really comfy. I need you to sink down into your chairs as much as possible. Sydney, I'm looking at you. If you have any pain in your body, I want you to get as comfortable as you possibly can. Now, I'd like to invite you to take 3 deep breaths in and out. I'm going to start. And another one. And this one, I want you to take the deepest of them all. Really push it. I want you to focus for a moment. I want you to focus on the feelings that are in your body. Take note of any unique sensations that you can observe. I want you to observe them and welcome them like guests, like welcomed guests. Are you feeling hot or cold? Do you have lots of energy? Are you feeling tired? I just want you to continue breathing in and out. For some of you, this is going to be the first time ever doing something like this, and it's going to feel a bit strange, and that's okay. Now, keeping your eyes closed, I want you to go back in time and picture yourself, quite literally you, within one of your favorite childhood memories. Take some time to do this. Just get really comfortable. It does not matter the specific age within this memory. Just picture any really happy memory. Where are you in this memory? Really take a moment to get a feeling for your surroundings. Are you with anyone in this memory? Family, friends, maybe pets? Picture the clothes you're wearing. It's okay if it makes you giggle a little bit. Picture the haircut and the hairstyle that you had. While you picture all of these things, can you see or smell anything specific? Any unique senses that are coming to you? Once you can visualize this child fully in your mind, I want you to introduce yourself as the adult you. Whatever age you are at now, introduce yourself and tell them that you are coming back in time to visit them, just to say hi. Nothing else, just to say hi. I want you to watch how they react within this memory. And I want you to ask them permission to give them a hug. If they say no, they're not in the mood for a hug, that is totally okay. But if they say yes, I want you to really imagine yourself giving that inner child the biggest hug you can imagine, one of those 30-second hugs that we don't exchange often enough. I want you to tell them in your mind, or out loud, either's fine, how much you love them and miss them, and that you will always be there for them. And I want you to wave goodbye to them. And I want you to watch them wave goodbye back. And I want you to bring your attention slowly back to the room. That was beautiful. That was self-love. Everything else pulled away in the world, that was self-love in and of itself. And as the world continues to feel increasingly unraveled over the next few years, it will be incredibly essential for us as nurses to do whatever we can to keep our cups full. I want you to look at the person to your left right now, and then look at the person to your right. And now we're going to do the exact same thing, but this time we're going to picture them as 5-year-olds. Really get that image in your mind. It's funny, isn't it? The realization that we're nothing more than 5-year-olds with adult bodies and adult responsibilities is the foundation for endless self-love. And I know a lot of us don't know each other. I've only had the privilege of knowing a few people in this room. But I want to end by saying, that I love that inner child of yours, and they're grown up too. Congrats, guys. We did it. Official.
I don't know if we can move this or not, but here we go. All right. So I'm here to start the awards presentation. The Leadership in Nursing Award honors nationally recognized Dr. Tracy Ortelli, a leader in nursing education, role model, mentor, and scholar who has dedicated her professional career to advance the development and assessment of nursing curricula and the certification and recognition of nurse educators. Dr. Tracy Ortelli was instrumental in the initial development of the pre-licensure baccalaureate program for Galen College of Nursing. The Leadership in Nursing Award was created to recognize BSN students who demonstrate outstanding leadership qualities by inspiring others, exemplifying personal integrity, serving as a role model and advocate, and upholding Galen College of Nursing's eye-care principles of inclusivity, character, accountability, respect, and excellence. The Dr. Tracy Ortelli Leadership Award for our BSN program goes to Brendan Horak.
Good evening. Leadership refers to the ability of an individual to influence the behavior of others, often inspiring their peers to function at a higher level. The Catherine Mershon Emerging Leader Award will be presented to graduating students from each program option who exemplify the following traits: ability to solve problems, critical thinking, respect for individual differences, active listening, skillful communication, clear goals and outcomes, and integrity. The Catherine Mershon Emerging Leader Award for our ADN 2-year program goes to Brittany Earls. The Catherine Mershon Emerging Leader Award for our ADN Advanced Standing program goes to Benjamin Reams. That's special. All right. At Galen College of Nursing, we know there are certain intangible qualities that some nurses instinctively develop that truly set them apart from the rest. These qualities cannot be measured with an answer key or a calculator like a test score or a grade point average. These qualities are more about human kindness, the human touch. More than a room number and a diagnosis. It's about making a patient feel singularly special. The qualities associated with the human touch include compassion and understanding and acknowledgement of feelings of patients, family, and fellow students. The Dr. Marjorie Perrin Human Touch Award winners are nominated by their fellow classmates. The Dr. Marjorie Perrin Human Touch Award for our ADN 2-year program goes to Jennifer Blair. The Dr. Marjorie Perrin Human Touch Award for our ADN Advanced Standing Program goes to Tricia Peterson. Congratulations to you all.
Now we'll start with the awarding of diplomas and the nursing pins. The first group of students are the Bachelor of Science in Nursing program students. Sydney Bagley. Shelby Chrisman. Yasmin Suizri Ephraim. Brooklyn Grizzle. Brendan Horick. Jamie Richardson. Jawan Subidi. Jawan is also receiving honors magna cum laude. Shania Taylor. Audra Weldon. Alyssa Volk. And now the graduates in the Associate of Science in Nursing program. Rebecca Abela. Crystal Allen. Amy Byer. Allison Bailey. Jennifer Blair. Jasmine Bolden. Danielle Berwick. Hallie Chartreux. Janice Dennis. Brittany Earls. Anna Edge. Lauren Ewing. Erica Fletcher. Misty Garcia. Megan Gleckner. Alicia Harville. Dylan Huth. Tiffany Johnson. Addison Kidd. Kevin Leach. Stacy McFarland. Mandy Miller. Tasha Morris McKeever. Andrea Owens. Jason Page. Barbara Page. Andrew Pearson. Trisha Peterson. Jennifer Prophet. Benjamin Reams. Bobby Shaw. Mindy Sparks. Jillian Stange. Stella Stroud. Laura Svensson. Melissa Thomas. Alicia Troxell. Sierra Turner. Alyssa Wellman. I think we should congratulate all of these outstanding graduates.
Sorry, guys, it's like right in my eye line. All right, so we have a tradition in nursing education. It is called the Ceremony of Lights. Through the Ceremony of Lights, the passing of one flame to another signifies the passing of knowledge and the acceptance of the responsibilities and the rights and the obligations of the nursing profession. We offer our pledge in this ceremony. Graduates, would you please rise, face the audience, light your candles, and then join me and the faculty in reciting the nursing pledge. I solemnly pledge myself in the presence of this assembly to practice my profession with integrity. I will endeavor to maintain and elevate nursing standards as both a science and art. I wholeheartedly recognize the importance of quality standards of care and of personal accountability. I will devote myself to the protection, healing, and welfare of those committed to my care. I will hold in confidence all personal matters committed to my keeping and will respect the privacy of medical information. I accept a duty to work for the improvement of health in the communities in which I live and work. I will act with compassion and ethical matters. I will not take or knowingly administer any harmful substance. I commit to interdisciplinary collaboration and lifelong learning. I fully acknowledge the seriousness of responsibility integral to the nursing profession and the significance of commitments I pledge today. Thank you. You can all turn around.
I'll find it sooner or later. Congratulations, you all look marvelous. this is still not it. I'm off my game. They have the nursing pledge in here twice. Here we go. Hear now these words of benediction. Our moment together in this place is at its end. For every heart and for every mind, may some word or gesture linger from this time to other times and give peace and courage and the will to do good. Amen.
And now we've come to the conclusion of our program. On behalf of the faculty and the administration of Galen College of Nursing, I congratulate you on this milestone in your life. We all wish you the very best in your future endeavors and career. And now on behalf of the Galen Board of Directors, Mr. Mark Vogt, our CEO, I proclaim you as graduates of Galen College of Nursing. Parents, spouses, families, friends, faculty, and staff, I present to you the July 2022 graduating class of Galen College of Nursing. You can now move your tassels to the other side of your hat. Congratulations, graduates. Best of luck in your nursing career.